Hi everyone, and welcome to another episode of Excela Health Virtual Mall Walkers, and happy May Mall Walkers Day. Throughout this month, we've been discussing stroke awareness and response, how you can identify and recognize a stroke, and how to react in the event of a stroke. In today's presentation, Dr. Kathleen Adams from Excela Health Neurology mentions the top stroke risk factors and how you can reduce your risk of experiencing a stroke. Fun fact for all you mall walkers, Joshua Adams, who we heard from earlier this month, and Dr. Kathleen Adams are married. Let's welcome Dr. Kathleen Adams.
Hello there, I'm Dr. Kathleen Adams. I'm the newest neurologist here at Excela Health, and I'm the director of the stroke program here at Excela Health. I'm here today to discuss stroke risk factors and how we can modify them. So why exactly do we take the time? Why are we taking a month to talk about stroke? What's so important about stroke? When we look at the data for stroke, we find that stroke is the 5th leading cause of death in the United States. And more so than that, it is the leading cause of disability in the United States. So that's pretty important. And that's why we take this time to talk about it. We found that upwards of every 40 seconds somebody has a stroke, and every 4 minutes somebody dies from a stroke. So there's a lot of people that suffer from this, and it's something that we really need to work on because upwards of 80% of these strokes that happen are preventable. So let's talk about risk factors and how we can modify them. I separate risk factors into 2 groups. We have the risk factors we can modify and the risk factors we can't modify. So we'll start with the ones we can't modify. The biggest one there is age. Your risk of stroke increases with age. Can't change your age, unfortunately, no matter how hard we try. Next, you have gender. So women are more likely to have stroke. However, women live longer than men. So we actually think that that's related to their length of life. And like I mentioned previously, as we increase our age, our stroke risk increases as well. We also know that race plays a role in stroke risk as well, and we can't change that. Unfortunately, the sad truth is that African Americans are more likely to die from stroke than their Caucasian and Latino counterparts. And then family history. I can't change your family history. I can't change the fact that your parents, grandparents had strokes at early ages. So we can't fix those. So what can we fix? Right? There's several risk factors that we can modify and we can take into our own hands, and we can decrease our risk for stroke. One of the big ones is high blood pressure, hypertension. It's very common and easily treatable. So when we talk about high blood pressure, there's a whole slew of medications that we can trial for patients, and everybody responds to medicines a little bit differently, and it's very important that you follow with your primary care doctor on a regular basis. But our goals for stroke, anyone who's at very high risk for stroke or who's had a previous stroke, is a normal blood pressure. But the data shows that less than 140 over 90 is really where we want you long-term for stroke prevention. Okay? Another risk factors that we can change is high cholesterol. So hyperlipidemia is the other name that you'll probably hear people talk about. And that's easily treatable, not only by medications, but also by diet and exercise. And we have statin medication that we use very frequently with our patients for this. And we base our stroke risk off of your bad cholesterol, your LDL number. And where we want that for our stroke patients is less than 70. So that's our goal for our stroke patients there. Okay. Another modifiable risk factor is diabetes. Okay. Very common as well. And also not quite as easily treated, but definitely treatable. Okay, and there's lots and lots of different medicines for diabetes. Again, why you have to follow closely with your primary care doctor if you have a diagnosis of diabetes. And as we get older, follow to make sure that we haven't fallen into the category of diabetes with age. So, goal for our stroke patients with diabetes is a hemoglobin A1C, and that's a lab test we do that tests your blood sugar over about the past 3 months. We want your number less than 7. And that's where we want you, and that where it decreases that stroke risk, okay? Another big one is atrial fibrillation, and that's a funny heart rhythm that you can go into sometimes. Some people know that they go in and out of it and they can feel that fluttering in their chest, and some people don't. But that AFib increases your stroke risk dramatically. And we have to use different types of medicines to prevent a stroke from AFib. So we'd be talking about stronger blood thinners like Coumadin, Eliquis, Pradaxa, those types of blood thinners. So that's something that anyone who comes in with a stroke, we look for atrial fibrillation. And if we find that, then we talk about different types of medicines that we use for this. Other modifiable risk factors are obesity. So diet and exercise is very important to prevent obesity and work on correcting that if we are in the obese range. And the other very big one that we have to talk about is smoking. And there's still a lot of people out there that smoke, even though we know the harm that can come from that. And that is a very significant risk factor for stroke. So we really try to encourage our patients to work on decreasing what they're smoking and really trying to work towards coming off the smoking, which we know is a very difficult process, but doable with time and with the effort. So these are some of the stroke risk factors that we really like to work on to modify and to really reduce our patients' risk of having another stroke. And really, from the patient standpoint, what you all can do is a good diet, a healthy, well-balanced diet, vigorous exercise, 30 minutes, 5 to 7 times a week, okay? And really following closely with your primary care physician and making sure that you are on top of any of these risk factors that you may have. Thank you so much for listening to my presentation today, and I hope you all have a great day.
We want to thank Dr. Adams for sharing how we can modify our lifestyle behaviors and decrease our stroke risk. Let's check in with Dawn to see how nutrition plays a role in stroke prevention on this week's segment of What's in Your Pantry.
Hi everyone, and welcome back to What's in Your Pantry. In keeping with the theme of stroke awareness, we are talking today about ways to manage or treat high blood pressure through diet. Now, many of us are aware that a diet that is low in sodium is preferred if you have high blood pressure or hypertension. But today we're going to talk about 3 hypertension busting nutrients that also help manage or control high blood pressure. And as you know, high blood pressure is a risk factor for stroke. Okay, so these 3 nutrients happen to be potassium, calcium, and magnesium. And our feature recipe, which happens to be a blueberry mango smoothie, contains all 3 of those nutrients. Okay, so not only is this recipe quick, it can be a grab-and-go breakfast, it can be a nutrient-dense snack, but it is full of our hypertension-busting nutrients, okay? And it is also low in sodium. So let's review the ingredients for our blueberry mango smoothie. Now, I've taken the liberty of simplifying this recipe a little bit. So for 2 servings of our smoothie, you will need 1 cup of fat-free plain Greek yogurt, 1 cup of fat-free milk, 1 cup of frozen blueberries, 1 cup of unsweetened frozen mango chunks, 1 tablespoon of honey, and a splash of vanilla. Okay, so not many ingredients. You can see lots of substitutions. Okay, so a lot of variety in this smoothie. So let's get started with the smoothie. You're going to take your Greek yogurt, and we're just going to put this right into our blender. And then we're going to add our low-fat milk. Okay, so these first 2 ingredients, the Greek yogurt and the milk, these are our calcium sources in this recipe. Next, we're going to add the frozen blueberries. Okay, if you don't have frozen, fresh would work. And And then we're gonna add the mango chunks, okay? These are also frozen, but again, if you don't have mango, I think a really good substitution here would be either bananas or strawberries, okay? But you want at least one of your fruits to be frozen because the frozen food gives a nice frothy texture to the smoothie, okay? So then we're gonna add our honey. And I like these little individual squeeze packets because it measures out to be just about a tablespoon. Okay, so this is going to give us some sweetness. And then we're going to add just a splash of vanilla. All right, and then we're going to give our smoothie a boost of magnesium. Now there's already magnesium in these ingredients, but I want to give it some extra oomph. So I'm going to add about a tablespoon of sunflower kernels. Okay, these are also going to give it a nice, very mild nutty flavor. Okay, and we'll just put our lid on the blender. All right, and then we're going to give this a whirl. I want to check the consistency of this because if it's too thick, you can add more milk if you like. Oh no, this is good. This is good. We're going to blend it one more time. Okay, so as I said before, you could substitute some of the fruits. A banana would be a good choice. Strawberries would be another good choice. You could also put spinach in this smoothie if you wanted to for a boost of hypertension, boosting nutrients. I think you could put oats in here as well. That would also give it a nice flavor. And then all you do is just pour it right into your glass. And I'm going to give this a taste. Oh, that is really good. Very fresh with the blueberries and the mangoes. I really think you're gonna like this, okay? So give it a try. It's high in potassium, has about 700 milligrams of potassium. Super low in sodium, only 70 milligrams of sodium. And a serving has about 200 calories, okay? So not bad there either. All right, our healthy habit tip of the day is keep your blood pressure in check by including foods that are high in potassium, high in magnesium, high in calcium, and low in sodium, therefore lowering your risk of developing a stroke. Okay, so that brings this episode to a close. Thank you for joining me. Until next time, I hope that you will stay tuned, stay healthy, and we'll see you later. Bye-bye.
Welcome back, Mall Walkers. We hope you enjoyed today's cooking demonstration and our healthy habits tip of the day. Don't forget to check your email inbox for today's featured recipe and resources highlighting stroke risk factors and stroke support. Until next time, stay safe, stay healthy, and enjoy your Memorial Day weekend. We'll see you soon, Mall Walkers.